Hello, welcome to week three. It feels so weird that we're going into week three. I feel like the course just started. So far, I have really enjoyed reading your work. I've enjoyed reading your discussion board posts. So I just want to say thank you all for the effort and the critical thinking that I'm seeing in your assignments. I'm still working on some of the grading, and I will release the assignments as they're completed, or some of them are already completed. I'm just going to release them at the same time. So you will have those coming your way. I also want to say thank you for reaching out and letting me know when there are technology glitches or errors and how things are set up in the system in this async format. So this is the first time, as many of you know, this is the first year that we've ran the courses. So this is the first time the CED 525 has been taught. And so there are sometimes things that are set up maybe incorrectly in the system or things that may be missing. And so I really appreciate each of you all for your patience and also for those who have reached out to let me know and I was able to correct those or get them corrected. So thank you so much. So I want to talk about your topics for this week. So this week you're talking about addiction and codependency and addiction and intimate partner violence, or you'll see it written as IPV as well. And so as always, I have a short lecture for you, just a quick verbal lecture, and then I'll go over the assignments really quickly, and then I will wrap this video up. So, welcome to today's lecture. We're going to be exploring some of the complex ways that addiction can show up in relationships. So, we'll begin with addiction and codependency, and then we'll move into the difficult but important conversation that we need to have around addiction and intimate partner violence. And again, also is known as IPV. So along the way, we're going to also talk about key connections between each of these. And we're going to talk about treatment considerations and protective factors that can support recovery and safety. So part one is going to be about addiction and codependency. So the term codependency originally came out of the addiction recovery movement, especially in families and partners of people with substance use disorders. Today, it refers to a pattern of relational behavior where one person consistently sacrifices their own needs to support, fix, or control another person's behavior. And this is often to their own detriment. So, codependency is often marked by poor boundaries, an excessive focus on the other person's needs or emotions, difficulty expressing one's own needs, and a deep fear of abandonment or rejection. So, in the context of addiction, a codependent partner might cover up for a person who's addicted to a substance or a process behavior. So, the process of addiction, they may make up excuses. They may clean up their messes, and we mean this literally and emotionally, right? So they may actually physically be cleaning up their messes, but they're also emotionally carrying that baggage and cleaning up what they may be feeling emotionally or trying to compensate for their partners or their family members' emotions as well. And they may end up ignoring their own well being in the process. So, this isn't about blame, right? It's about survival. So, codependency often develops in response to unpredictable, chaotic, or traumatic family systems where emotional needs were unmet. So people learn to feel safe by taking care of others and especially those in crisis. But over time, this caretaking can become compulsive and it reinforces the addiction cycle by protecting the person who may be addicted from the natural consequences of their behavior. So that's just a little brief overview of the codependency. So now we're going to talk about intimate partner violence, which includes physical, emotional, sexual, or financial abuse between current or former partners. So addiction and IPV often co-occur. So research has showed us that substance use does not cause intimate partner violence. So I want to repeat that again. Research has shown that substance use does not cause intimate partner violence, but it can increase the frequency, intensity, and danger of abusive incidents. So, and why is that? Because substances can lower inhibitions, it can increase impulsivity, and it can escalate conflict. So, substance use may also be used as an excuse for the violence or an excuse to manipulate or control a partner. So, survivors of intimate partner violence may also end up turning to substances as a way to cope. Again, remember I just said may. Does not mean that all survivors of intimate partner violence will turn to substances. But research has shown that some survivors may also turn to substances as a way to cope with trauma, a way to numb the pain, or to feel a temporary sense of control. But over time, substance use can make it harder to leave, harder to stay safe, and harder to trust support systems. So, in some cases, both partners may be using substances, and the lines between victim and perpetrator become blurred. And other times, an abusive partner may control or monitor a survivor's access to substances, treatment, or support, and they use addiction as a weapon. So, now we're going to talk about so how are codependency, addiction, and intimate partner violence connected? So, all three involve dynamics of control, trauma, and emotional dysregulation. Again, all three, codependency, addiction, and intimate partner violence, all involve dynamics of control, trauma, and emotional dysregulation. So, in codependent relationships, one partner's identity may revolve around saving the other, while in intimate partner violence, power and control are used to dominate and harm. So it's important to recognize that addiction can intensify both of these dynamics, and which makes it harder to set boundaries, harder to access support, and harder to heal. Now, it's important to note that codependency is not the same as intimate partner violence. Again, I'm going to repeat that. Codependency is not the same as intimate partner violence. And not all codependent relationships are abusive. I repeat that one too. So, not all codependent relationships are abusive. But what we see is that both codependency and intimate violence can be deeply damaging to individuals. And both require us to be compassionate and work from a place of trauma informed care. So, if we talk about treatment for addiction and these relational dynamics needs to be integrated and individualized. And what we mean by that is you just can't say, okay, we're not going to worry about these dynamics. We're only going to worry about the addiction, or we're only going to worry about the intimate partner violence. Like we have to work on those and integrate those together. And we have to make sure it's individualized for that individual and their situation, right? Always remember that it's never a one size fits all model, right? And that's why it's so important to get to know the individuals that you're working with. Because what can easily happen is that we slip into that, like, oh, well, this is what works for this person, or this worked for my previous client, so this must work for this client. And that is not how we work with individuals, right? We work with individuals is recognizing who they are individually, who they are culturally, right? And what is their situation. So for codependency, treatment may involve psychoeducation about healthy boundaries. It may include any type of therapy or treatment that's focused on self-worth and emotional regulation. And there's also things such as support groups that are like there's a Codependence Anonymous, so that is that they can attend. Or if it's also with the substance use, there's a Al-Anon group as well that they can attend. For intimate partner violence, we must always remember the first priority is safety, right? So survivors may need emergency shelter, legal support, or trauma counseling. Substance use treatment must also account for the survivor's trauma history and the risk of re-victimization. So again, when we're doing substance use treatment or addiction treatment, we must account for the survivor's trauma history and the risk of re-victimization. So in cases where the person using substances or the person who is using the violence also struggles with addiction, there are particular programs such as batterer intervention programs. And North Carolina actually has a batterer intervention program, and it's called North Carolina's Batterer Intervention Program, or BIP. And so in those cases, like I said, when the person using violence also struggles with addiction, there's programs such as the batterer intervention programs, and substance use counseling may be needed in parallel. But we must remember that is not a substitute for accountability. Regardless if there is addiction and substance use, If there is violence, we are not saying that the substance use is a substitute, is going to take away the accountability for that person. That person still needs to be held accountable while also recognizing that they're struggling with addiction. So helping with the addiction side and also with the batterer side. And showing, like I said, the accountability still has to be there. So there's challenges in treatment, and these challenges include denial or minimalization, especially in abusive or codependent relationships. Another challenge is the lack of access to trauma-informed care, right? Because trauma is involved in these situations. So we have to learn more about trauma. If you are not familiar, you have to understand how trauma affects individuals. You have to understand what trauma-informed care consists of. Another challenge is fear of losing custody, housing, or relationships. And lastly, another challenge is stigma, right? There's a lot of stigma out there when it comes to relational aspects and already when it comes to addiction, right? So if there's already addiction involved and now we're adding in these relational dynamics such as codependency or intimate partner violence, there's a lot of stigma when it comes to particular groups, particularly for women and for members of the LGBTQIA population. And so we must remember that when we think about treatment and when we're working with our different clients or patients or consumers. But there's also protective factors. So these protective factors are strengths that can support healing. So some protective factors include a strong working alliance or therapeutic alliance, um, depending on what your profession is. So there's different languages. It can be, like I said, a working alliance, a therapeutic alliance, the counseling relationship. So it's important that we work on building that therapeutic alliance and working when we're working with our clients, our patients, our consumers, to remember that we're listening without judgment. We're providing that non-judgmental space, right? We're creating that safe space. Also, another protective factor or strength is access to peer support and community networks, right? So connecting individuals to these community networks, connecting them with peers where they can feel validated and supported. Also, another protective factor is stable housing and financial support, right? Because if someone, as we think of Maslow's hierarchy, right? Like individuals need stable housing, right? So it's hard for me to focus on those other things if I do not have stable housing or nowhere to live, or if I do not have the financial support, right? Which we know can cause people to stay in some situations because those are very important needs. And perhaps most importantly, hope, right? And so that's a huge supportive factor. Hope. We must help support the idea, right? That change is possible, right? We must push that belief that change is possible and change can come, right? So hope is important because when someone feels hopeless, they may not feel the need to change. They may not feel the need to continue on, right? So we're helping them also recognize that hope and change is possible. So, in conclusion, addiction rarely exists in isolation. It's very relational. So, whether it's shaped by codependency, fueled by abuse, or used as a shield against pain, it affects how people connect, cope, and survive. So, healing requires more than just sobriety, or as you learned last week about harm reduction, healing requires more than just sobriety or just a reduction of use, right? It calls for safety, boundaries, self awareness, and connection. And as helping professionals, we play a vital role in supporting people through that process. And we support them through that process with compassion, not judgment, right? We are providing that compassionate, safe space where people can heal, right? Where they can learn about safety, they can have safety, they can learn about boundaries, they can grow in their self awareness, and they can build connection. And sometimes that first place of building connection is with you, the provider or the professional who is working with them. So before I wrap this up, I do want to say I want to leave you with a few questions to reflect on and to sit with. You don't have to respond to me. This is just for you, right? Because it kind of helps you understand and kind of grow within yourself. So the first reflection question I want to leave you with is how might your own experiences with relationships, boundaries, or caretaking shape the way that you understand codependency or addiction? What biases or assumptions may you carry about people who stay in abusive or substance involved relationships? And how might those impact your work? And in what ways can you support both safety for an individual and their own self-determination when working with clients who are navigating addiction, intimate partner violence, or complex relational dynamics? So I want you to take some time to reflect on these questions. They don't have easy answers, but they can open the door to insight, empathy, and growth in yourself and in your own work. So that is the end of the lecture. I'm going to briefly just mention your assignments for this week. You have one discussion board prompt. And if you see me looking, I'm looking at my other screen. And so that discussion board prompt is going to focus on addiction, codependency, and intimate partner violence. So I think it's three questions for you to reflect upon for this week. And then your other assignments. So then you have two assignments. And the first assignment is exploring the intersections of intimate partner violence and addiction. So in this one, you're going to do a brief like research and analysis, like 1 to 2 pages, where you address the questions here. And then part two is going to be more of a case scenario and treatment response. So pages 2 to 3 pages for that portion. And again, remember, like I said, I know people come into this certificate in different places, so you may not have took certain courses. So if there's certain questions again that you are not really like, oh, I don't know enough about that. Again, I just want you to do hypothetical. Like, what do you think, right? Without knowing, like if you don't know a particular assessment to use, you can say, I'm not really familiar with assessments, but I would think this is the information I need to gather, right? And make sure, like I told you, that you note that I'm unfamiliar with assessments, but this is what I think. That is perfectly fine. And so then for part two, you have some discussion and application questions. And then part three of that assignment, you have a personal reflection that's 1 to 2 pages. And then your second assignment is going to focus on understanding codependency in the context of addiction treatment. So for this one, it's just a case study. So you will be provided with a vignette, and then you will take that vignette and you're going to respond to some questions that are listed there in 2 to 4 pages. So those are all your assignments for this week. I know some of you all probably are having a longer weekend due to the holiday. If you are, I hope you all, if you celebrate the holiday, I hope you have a great holiday. If not, I just hope you have a great weekend. Do something that you get to take care of you and focus on your wellness and self-care. And as always, if you have any questions, please feel free to reach out to me just through email or anything. I will be off email for a few days due to the holidays starting on Friday. But I will definitely be checking in. So again, it's been a pleasure to keep working with you all this semester and take care.